So about 10 years ago, when I was looking for a job, there wasn't anybody doing this as a specialty. There were many people who were going to the hospital as a service at the end of their clinic day or at an academic center. If the attending had finished rounding in their clinics with a resident, then they would go to the hospital to round. So what's happened now is a movement towards focusing someone's interest, academic interest, on taking care of patients in the hospital. So many academic centers, not all, but many, have a hospitalist dermatologist. They're in the dermatology department, and as a service to the hospital, they spend a lot of time in the hospital. But they're still part of the dermatology department. In the community, we're still having a lot of issues getting dermatologists to the hospital, and there are many barriers to that, and we're working on trying to figure out what those are and working on trying to get dermatologist presence in the hospital in some way, because those patients are sick and need our help, and the internists need our help as well. There are new movements in the field of teledermatology where somebody who doesn't have a dermatologist could, example, send an image of a concerning lesion, for example, to somebody who does do inpatient dermatology and guide them about the next step and workup management. That's still growing. There are lots of issues there as well, but the American Academy of Dermatology has taken it upon itself to address those issues in conjunction with our group, Society of Dermatology Hospitalists, to try and address those issues. There are issues with images. Dermatology is a very visual field, so that lends itself nicely to a picture. But quality of that picture image is important, and also knowing what to take pictures of. So how far away do you stand away from the patient? How do you create a global view of the distribution of the eruption so that the consultant can guide you better about what the differential diagnosis might be? It's a very tactile field as well, a specialty as well. So there is that component, but if you are, for example, video chatting with somebody, you can guide them on where to point the camera. You could also ask them, what does it feel like? You could ask for some details about the surface change, for example, of the lesion. So there are ways to get around that, yet we're not there. It's still in development.